3 ways to use a little ball like this to relieve back pain at home. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. Today, I want to teach you how to use a little ball like this, kind of a playground kids ball, in order to release tension and pain and discomfort into your lower back. All you have to do is get a little playground ball, like 4 to 6 inches in diameter, and I'm going to show you 3 different places that you can try on your body to release your back and to help with your back pain. The first place we're going to use this little ball to do a myofascial release is going to be into the hip flexors. So part of your hip flexors attach onto the front side of your spine, and when they're tight, so your hip flexors run here, okay? When they're tight, they can pull onto those bones of your back, and it can cause some strain into the back. So what we want to do is actually use this ball to release into the front side to help the back side. So what I suggest is get 2 pillows and your little ball. You might want to start on a soft surface like your bed or a couch versus the floor if you're just beginning with this. You're going to take your 2 pillows, put one down low and one up high. And I'm going to show you how you're going to place this for support of your back. What you're going to do, you're going to lie down, but you're going to take the ball and you're going to place it just to the side of your belly button. Okay, so I'm going to release my right side here. So what I'm going to do is just place that ball where I want it, and then I'm going to lie down. So I'm going to have one pillow underneath my lower legs, and one pillow is going to be underneath my chest. So I'm going to lie down here, and I'm going to place this just to the side of my belly button. Okay, and then I'm going to kind of hug this pillow here. I would lie down, face down, and cradle my forehead onto my hand. So let me show you that without talking. So with that, we don't want to be turning the head to the side and creating some strain into your neck. With this release, what I recommend is that you hold this position, allowing your body to drape over the ball and allow that ball to sink into those hip flexor muscles, and hold that position if you can for 5 minutes. At a minimum, I would recommend a 3-minute hold, but ideally if you can hold 5 minutes, and if it's feeling good, you can hold even longer. When we hold that long, we're actually doing a myofascial release. So we're releasing the fascia or connective tissue of your body in addition to the muscle. So that's going to lead to more permanent release and relief for you. So give that a try, and let's move on to the second tip. The next place we're going to put the little ball is directly into the lower back. So with this one, you get to decide exactly where you want to place this. But you can go over the direct area where you're having some discomfort, or you can go above or below that, especially if you're having quite a bit of discomfort. So what I'm going to do here, again, I recommend if you're just starting out, be on a soft surface like your couch or your bed. You're going to take the ball and you're just going to find an area into your lower back along the side of your spine into the muscle, and you're just going to place the ball there, and then you can lie down. From there, you get to decide if you want to have knees bent, where you can have a little more control over how much weight you're putting on that side. So I have this on my right side, as you can see, and I can control where my legs are. I can come and bring them to the right side and put a little more pressure there. Or if I'm really sore, I can actually bring the legs to the other side and take off a little bit of the weight there, but I still have it in contact. Alternatively, you can go ahead and straighten out your legs. It's completely up to you, but you can put a pillow underneath your knees as well if that brings a little bit more comfort. So again, I would recommend to hold this in place and allow your body to soften over it for 3 to 5 minutes or longer if it's feeling okay. All right, let's move on to the last tip. Another area that you can try to use the little ball in is into your hip, kind of your glute muscles, the backside, your butt muscles, okay? So with this ball, I would recommend find a chair that you're going to feel comfortable in, preferably not a really hard dining room chair, more like a softer chair, especially again, if you're starting out, and you can always move to the floor in time if it feels okay. But basically, you're just going to take the ball, and you really can use it anywhere along the backside here. I can place the ball right behind my kind of very low back into the glute muscles. I could bring it all the way underneath and sit on top of it. so that I'm getting into the hamstring muscles here or anywhere along the glute area. I could even place it behind me and rest against it, or place it underneath and rest on top of it. So again, hold for 3 to 5 minutes. And with all of these techniques, I recommend try to do it in an environment where you're not going to be distracted. So allowing yourself to let your body drape over the ball and soften, and also pay attention to what you're feeling. You can always give yourself permission to stop at any time. If you're using the ball and it just feels like it's really strong and you're not tolerating it very well, or if your body is really kind of bracing against it, that might be a good time to go ahead and stop. But you have to decide that on how you're feeling. Sometimes your body can feel a little bit more sore initially when you first put the ball into place. And then as it starts to soften, you'll notice that you have an ease or some relief of your symptoms. So you will have to decide for yourself on what it's feeling like and whether you continue or whether you stop. Give those tips a try, and I hope that they help to relieve your back pain. If you have further questions or want some one-on-one guidance from our therapist here at the Healing Spot to relieve your back pain, reach out to us. We would be happy to answer any questions that you have and help determine what's the next best step for you. The best place to go would be to head to our website, healingspotpt.com, and pick whatever option works out the best for you, and let our expert team help you feel better, feel more confident, and more active in your life. Thanks for watching this Ed Talk. I will see you on the next one.